We have another in our series of COVID Chronicles. There's plenty of lies and misinformation in coronavirus. So Truth Lies Shenanigans brings you the truth. Stories directly from the people that lived it, frontline workers and survivors. This is the COVID Chronicles. There she is, Yolanda Evonne. Welcome. So,
Yvonne. Hello,
Welcome,
welcome.
Yolanda.
Hi,
so
thanks for having me.
joining our show,
Thanks for
we have Yolanda Evonne, a nurse who works at the Washington Hospital Center in DC. She's a registered nurse on the pre-post cardiac procedure unit. She also works at the stroke tele at Charles Regional in La Plata. She's been a nurse for 4 years. Thank you again for joining our show, Yolanda.
thank you.
Thanks for
Welcome.
having me.
All right, so what I'd like to do is just tell us a little bit more about yourself, what your duties are, what you're doing right now.
So, I'm a cardiac nurse currently. My current unit, we deal with pre post procedures for cardiac issues. So, people are getting ablation for dysrhythmias. They're getting pacemakers. Um, they're getting cardiac caths and getting stents put in. So my unit is strictly elective
Okay.
with some emergency cases.
Okay.
But when COVID hit, because those elective procedures totally went away, they turned my unit COVID.
Okay.
So we were one
So
of the
you're dealing
first
a lot with
units
COVID now.
to. Well, currently we're back cardiac, but with the surge in numbers, the units are starting to slowly go back to COVID. I see some COVID cases now, but my unit is not completely COVID, but we do have COVID cases.
Okay. Now, of course, COVID is surging, particularly in DC and Maryland and nationwide. What are you guys seeing? I mean, are the hospitals filling up out there?
Oh, it's crazy. It's filling. It just filled right back up just like that. Like in a couple of days, it was everybody. Nobody had COVID, and then all of a sudden the unit is half full with COVID to the point with the next day. It just happened really quick. And then the day after that, it's like, okay, units are full. So we're expecting my unit, when I go back this week, my unit is probably going to be COVID again because it just happened so quick.
So let me ask you this. One of the important things we want to know is how are you and your family handling, the COVID, the virus and the pandemic? How are you handling? Are you okay? Is your family okay?
Yeah, we're good. It's hard. It's difficult because you're scared of bringing it home to your family. Even though my COVID cases aren't as high as they were when I was dealing with it strictly. Um, you're still walking through the hospital. You don't know who may have it. Um, People can be, asymptomatic, but everybody's wearing masks, so that's a good thing. I come in, I disinfect myself. I take my scrubs off. I try to stay away from my kids as much as possible, but they're young, so it's hard. So luckily, nobody has gotten it in my house, but it's scary.
Okay. Okay. Um, Robbie, do you have any questions?
Yeah, so Yolanda, hats off. Thank you for all of the work that you're doing for the community. I think that healthcare workers during this last year are to be absolutely commended and cherished. Um, my question is more, I guess, an external thing. When you're out in the general public, what are the types of things that you are seeing that, I guess, the contributing factors that you're really seeing to the COVID epidemic?
The biggest contributing factor is people not wearing their masks. That's that's the biggest thing. People aren't taking it seriously. And sometimes they're not even if they're wearing a mask, they're not wearing it correctly. So if I see that if they have on a surgical mask and they have it on backwards, I will say to them, hey, that's on backwards. The filter, they'll be wearing the filter on the outside instead of on the inside. So that's it's very important that if you're wearing it, you're wearing it. correctly. People not, staying 6 feet apart. I've been in stores where people are like right up on me, and I'm turning around like, hey, 6 feet, you need to back up. Um, those are probably the two biggest things. And then there's no limitations anymore with how many people are in the stores. So
Mhm.
it's like, it's crowded. Everybody's up on each other. So I try to go like at the store when it first opens or when it's about to close, when it's the least amount of people um, in the store. The masks do work and social distancing works. So if everybody does that, then, we'd be able to get it more under control. But a lot of people are non-believers. They don't think that they can get it,
Mhm.
or they feel like, oh, I'm healthy, so if I do catch it, I'll survive, but that's definitely not true.
Yeah.
So
Lizzie,
I
do
mean,
you
they could,
attribute,
but
oh, go ahead.
just because you're young and healthy does not mean that you won't catch it and pass away. I've seen it.
Well,
yeah.
Robbie,
So
go ahead.
do you attribute this cavalier attitude toward the mask and the distancing directly to the president, directly to the White House and the messaging that's been coming out from that office?
Good question.
I think that a lot of people who aren't wearing the mask um, are his supporters. I hate to say, but I just recently, I've really needed a break. So I went to Florida. I went on the Gulf where I did my research before I went, and on the Gulf Coast, the cases were like few to none. So we decided to take, a quick vacation there with precautions, of course, mask wearing, social distancing. And this is in Florida, and nobody's wearing masks. They're not. I was appalled.
Wow.
I couldn't believe it.
Wow.
It's like, what? Yeah. So, I mean, sadly, I think a lot of it is from him. And, um, I mean, I see some black people too who don't believe it because they feel like, the government is making this whole thing up and
Hmm.
they're trying to, you know, make us
Yeah.
think. And it's just a lot of falsehoods floating around.
Lizzie?
And unless, people, they don't see it with their own eyes, they're not believers. I wish I could record, what I see, make people believers.
Lizzie?
Well, that's a good segue into my question because I was wondering, going back to when your unit was completely COVID with COVID patients, or even now as it's unfortunately like inching back to that, what are you seeing with patients? Like, what are the symptoms when they come in or when they are in your unit?
Um, so I'll talk about my stroke and tele unit that's in La Plata because I just recently dealt more with COVID patients there. These people are struggling to breathe. They're scared um, because even taking a sip of water drains their drive to breathe. So their oxygen will drop really quick just to try to take a sip of water. Um, a lot of people, some people don't have the fever. I just had a patient who didn't have a fever, but he had the coughing and the shortness of breath and just exhaustion. Just
Mhm.
So the
you
symptoms
just literally
are
can't even get
inconsistent.
up to go use the bathroom
Wow.
because you're so tired.
Wow.
Yeah.
And how long, I mean, normally for the patients in the COVID unit, how long are they usually there, give or take?
Um, it depends on their symptoms. So some people can be there as long as 7 days. Some people, if they're asymptomatic and they're really not short of breath, they may keep them for observation for like 24 hours and then they send them home to wet the rest of it out. As long as they're not short of breath, um, then we send them home. But if they're short of breath and their oxygen saturations are really low, we keep them as long as, we need to. When this first started, I had a patient that was on my unit for 3 weeks because no matter, I mean, his oxygen just never came up. He ended up having to go home on home oxygen.
Wow.
So it can have long term effects too. Some people, it damages the lungs so bad that, they're going home on home oxygen, and who knows if they'll ever get off. It could be permanent.
And these are the things I think that a lot of people aren't taking into consideration, because the first thing you hear for the people who are resistant to the idea of COVID, or who think that it's not that big of a deal, one of the first things that comes out of their mouths is, well, did they die? If they didn't die, then it's not a
Right.
big. And I'm just like, there have been plenty of people. We had a guest, Marcus Eason, one of our COVID Chronicle guests. We had him on over the summer. And no, he's still with us. So he did not die. However, he lost some fingers. He was on a ventilator for like 14 days. He had a stroke. And he's still, even though he has come out of it and he's getting back to normal, he still has some lingering effects. And so I want
Oh
to say to
yeah.
those people, given the things that you were saying, that he's saying, or whatever, if you can just put on a mask and avoid all of that, why not? Like, death is not the
Exactly.
worst thing that could happen to you. You could be living on this earth in pain. Like you said, not being able to breathe, being on a ventilator, having strokes, losing limbs. I mean, it just runs the gamut. And so even though we're now in December, so we're 9 months into this thing. And to hear you talk about people who still don't get it, you see people who aren't socially distancing. We see people on the internet and pictures walking down the street. I have people in my building who the concierge, they have to yell at them all the time because they don't have masks on. It's mind boggling because it's not asking
It is.
much. It's not
It's it,
asking
it
much.
it really isn't. Just put on the mask, and then you have to. If you're not just protecting yourself. You're think about somebody else that you could be protecting, because you don't know, you could have it. You could just be asymptomatic. You just put on a mask. I was in Walmart today, and the guy just darted into Walmart, and the people at the front was like, "Hey, hey, you need a mask?" And he was like, "Oh, you have to wear a mask in here." I'm like, "How long have we been doing this?
Come
Yeah,
on,
Because you
God.
didn't know that you
especially in
had to
the
wear
Washington
a
D.C.
mask."
area.
Yeah,
I mean,
it,
everybody knows it
I
here.
couldn't. I couldn't believe it. But like you said, I wanted to piggyback on the whole long term effect thing.
Mhm.
I know a lot of my colleagues that have gotten it, and I have friends that have gotten it, and I have family members that have passed away from it.
Oh no.
But the ones who haven't, I have a colleague who still gets short of breath, and this was 2 or 3 months ago. She still hasn't been able to go back to work. I have another colleague who, another long term effect is like foggy brain, um, just really forgetting how to do the little simple things. And she was telling me the other day, she's gone back to work, but she was in a patient's room, and she just was like a deer in headlights. And the patient asked her, was she okay? And she said, yeah. And she stepped out, and she just said she felt so embarrassed because she's at work, she's doing her job, she's working with patients, and right in the middle of dealing with the patient, she got foggy brain.
Wow.
And who knows how long that will last. It could be permanent. So yeah,
Wow.
more than just death. Do you want to really live the rest of your life on Earth like that? Or having to carry an oxygen tank for the rest of your life?
So,
Possibly.
Exactly.
Yeah.
so we've learned that the vaccine is coming out. We just got the first vaccine doses recently. Are you finding that people are excited about the vaccine or skeptical? And on top of that, would you be willing to take the vaccine, or are you being mandated by your hospitals to take the vaccine?
Um, so I find that people are very skeptical. People think that, it's too fast, it's too soon. Um, in my hospital, I'm pretty sure we're mandated to take the flu. So I'm pretty sure that they're going to mandate us to take the vaccine. But even if they didn't, I'm going to take it
Okay.
for sure.
How do you? So you're good with the mandate of having to take that
I'm
vaccine?
fine with it because I was going to take it anyway.
Okay.
mandate or not,
And
I
you
was going
mentioned
to
you had
take
some
it.
family
I,
members that passed away.
I did.
Wow.
Yes, I had a cousin that passed away this summer, and then 1 month after my cousin passed, my uncle passed away. He didn't pass away from COVID positive. He passed away from the uh the long term effect of what COVID can do. He got an encephalopathy on the brain, and then it just caused like 20 and 30 other issues that happened to him, and he ended up passing away.
That's
So,
so awful.
I
I'm
can imagine the
sorry for your
vaccine being
loss.
very important to you.
Yolanda, have you
Yeah.
had patients ask you about the vaccine?
Have I had patients ask me about the vaccine?
Whether or not
No,
they
I
should
haven't
take
had
it?
anyone. No, I haven't had anyone ask me personally about the vaccines. I've had family members and
Mm.
coworkers. We discussed it amongst ourselves, but no patients with that. Yeah.
And
I
I've said it 1,000 times on this show, in comments to friends, whatever. Again, I am type 1 diabetic, immune compromised. If I'm first on the list for the vaccine, sign me up. I will be there. I will finally leave my house to go take it. One, because I think, again, I really can't afford, given my diabetes, I really can't afford to get this disease or to get this virus, because I think it will affect me differently than the average person. But also, too, I think as Black people, we need this representation. We need to see how it's affecting us and people in our communities. I mean, if I had been asked to take one of the trials, I would have done it. I probably wasn't asked because I never leave my house for anything. But if I had been asked, I would have done it because I think it's important to have that representation. So it's a conversation that I think a lot of people in our community are having. Hopefully, we are having this conversation and making opinions based on proper research. Like, I respect people that feel like they don't want to take it or they want to wait, if you will. I totally understand
Yeah.
that. I just want
Hmm.
people to get the proper research and not buy into the conspiracy theories or the rumors. That's my
comfortable.
concern.
Yeah. And that's what most people are doing. The conspiracy theories. They're listening, to that. And like I said, the biggest thing is that they feel like, oh, it's too fast for a vaccine. But I'm my stand is that it's 2020. Um,
Exactly.
I'm just not thinking
Exactly.
that it's taken that long, like it did back in the 1900s, to come up with a vaccine. Medicine has advanced so much. I literally watched doctors feed catheters through someone's femoral artery, which is the thigh, come up around the heart to put a stent in to remove a blockage. That's how much medicine has advanced. They didn't be able to do that in the 1900s
Right.
to prevent
Yolanda,
someone from having a heart attack.
I had this conversation with someone this week. She was like, "Well, how come it took them longer to get a vaccine for the Spanish flu?" I'm like, "You mean the Spanish flu that first started
1918?
in 1918?
Yeah,
Hello, hello, we're talking a century ago."
yeah. Things progress, things advance. I told a friend of mine the other day, I said, you see how fast things have started to come on DVD now? It used to take a year or so. Now it's like a couple of weeks. So, things progress as the years go on. We're not back in the 1900s. So, and these scientists, I did my research, they've worked literally day and night, day and night,
Mhm, mhm.
day and night.
A
I
lot of
don't know if they,
research has
in 1912 were they doing that, but they literally have barely slept to try to come up with something because they knew how critical this was. People are dying
Mhm.
every day.
All right.
And
And Yolanda, just
it's
Go,
been a
Robbie.
collaborative effort worldwide, and so that has helped with the research as well. Rob?
mhm.
Right.
I was just going to say that so much other medical research has been put on hold in lieu of COVID research. So
Mm.
we're losing out in some areas because of the focus internationally on COVID, but we need that concerted effort internationally. We need to collaborate and share that knowledge and those resources if we're going to come up with an efficient vaccine that needs to be implemented to 7 billion people on the planet. Like this
Right.
is a huge endeavor, huge.
Yeah. All right. So we've
Absolutely.
got about just a couple more minutes, but I want to get some questions in that we have online.
Some
Um,
great questions.
yeah. So what do you think? What do you say to people that say it's my family, we are fine? I think she's asking like when people saying are getting in groups, gathering in groups.
Mm.
I'm
Like
sorry, repeat
Mm.
the question again.
he's like, what do you say to people that say it's my family, we are fine when they gather for like Thanksgiving and things like that?
Do you know where your, if it's inside within your own household and you know exactly where your family members have gone, where they've been, who they've been around, that's, one thing. But if you don't know where that family member has been and then who that person has been around, it's still a high chance of you getting it. I mean, today I have a friend of mine who was with her immediate family for Thanksgiving, and the brother has tested positive for COVID because he came from wherever he came from, and he's brought it into the house, and then now the other brother has it, and so now the parents are getting tested, and his daughter has to get
The
tested
entire
because
families.
this
Wow.
from the one person, but that's her brother. That's
Yep.
her brother,
Wow.
and they trusted him. You can't trust anybody unless you know exactly where they've been, who they've been around. Seriously, like every step that they have taken.
All right. Marjorie Simpson, who actually was a previous COVID Chronicles guest, says it must feel so frustrating to fight so hard for your patients while so many Americans still doubt that COVID virus is serious or even exists.
It's frustrating. I've gotten into battles online with
I
people
bet.
who are
Imagine.
non-believers. It's super frustrating, and some people, will come on in my defense and say, how can you tell this nurse what she's seeing with her own two eyes? Like
Exactly.
I'm
Yeah.
seeing it with my own two eyes. I'm taking care of this person. I'm seeing them struggle to breathe. I'm seeing them on dual oxygen therapy.
Uh-oh, I think we lost
We
our
lose.
audio.
Oxygen dropping,
No, it's
not
not.
even being able to sit up to use a urinal to go to the bathroom
Mhm.
because they're just so fatigued. So yeah, it's super frustrating. I feel like they're non-believers until it happens to somebody that they know or somebody that they
Mm-hmm.
deeply care about.
Yeah.
Yep. That's what they're waiting
Then
for.
maybe they may be a believer, but people are still saying, "Oh, but it's only 0.001 whatever percent death." It's still a small number. But the fact is that these people would still be alive if this virus wasn't here. It didn't have to be that 0.01 death
All right,
from
this is
COVID.
this is a great question that came through. How do you feel about fellow coworkers that do not follow guidelines
Mhm.
when they are on their private time? This is coming from Rupka. Um, I know there are some uh, healthcare workers. I think recently there was one who was on TikTok
In Oregon.
making light
In
of it, and
Oregon.
then in Oregon, and she got
Yeah,
fired for it. So how do you feel about that?
I think it's hypocritical that you are at work, you're wearing your mask, you're doing, what you're supposed to do. We're having to educate patients on what to do to be safe. And then you go out into the community and you're not doing what you're supposed to do to be safe.
Yeah,
So it's kind of like you're coming in to help battle something, but you're not out in the community trying to help prevent it.
yeah.
Right.
So that's frustrating too. Luckily, I don't work with anybody who's like that.
Right.
All of us are very diligent.
Yeah.
Because I will call them out for
I
sure.
bet you would. I bet you would.
I will call them
There are
out.
there's some quick comments. Mike Winter points out that CNN just reported a new death toll today of 2,939 people. Almost 3,000 people died in one day today. Um, Jacqueline Robbins says the ignorance is astounding. Alexa Birdsong, whole new world. Kevin Thaxton, pro.
Alexa.
He's pro. Wait for the results. So
Kevin Jackson has
he
some good
said,
ones too. He's ready to take. He's ready to take it after the first batch doesn't turn us all into zombies. So he doesn't want an I Am Legend scenario.
right.
It's
And you know, if people want to,
Go ahead. I'm sorry. Go ahead, Yolanda.
I was gonna say, if people are skeptical and they want to, wait until the first batch has gone out, then that's perfectly fine. I tell the friends of mine who are skeptical, hey, healthcare workers are probably going to be the first in line. So once I take it, and you see that I'm still fine, then I hope that will, give you some courage to go ahead and take the vaccine because I don't foresee COVID going anywhere.
Yeah, we had
We
a
need,
pre.
we need
Lizzie and I had a
that.
pre-discussion about this same topic, and she was, of course, she's going to be first in line as soon. I mean, which makes sense, of course.
Second. I'm not going to be first. I'll be like second or third.
Yeah, I'll be. I'm going for. That's how I feel. I feel second or third. I mean, for a couple of reasons. One, I'm like Kevin Thaxton, saying, I want to see if, as long as people don't turn into zombies all of a sudden, I'm good.
Well, I'll be second or third, not by my choosing. I'll be second or third
Right.
because that's where I fall.
Right.
But you and Rob both mentioned zombies, and for The Walking Dead to be such a popular show here in America and abroad, I'm kind of shocked and surprised that people are taking this skeptical approach
That's a good point.
to a vaccine.
That's a good point.
Like, how do you think? What do you think turned these
The
people
zombies.
into zombies on The Walking
So
Dead?
the fact that the name of the company that Trump was affiliated with, Regeneron, has that whole implication in the company name. Yeah. The zombie nerds are going, don't take it. Careful.
Unfortunately, we are out of time, Yolanda. So, are there any final thoughts that you'd like to share with our audience, with our panel here? Just anything that you'd like to say.
Just wear the mask. It works. The mask works. Another thing I want to touch on is that I had someone ask me, well, why do you think we're not hearing about the flu or people haven't gotten the flu? Well, it's probably a couple of reasons. One is that people have been wearing the mask, and two is that we've seen a surge in people who've gotten flu vaccines this year.
Mm-hmm.
Like I'm usually having to give at least on my shift at least two vaccines per shift at least. I haven't had to give a flu vaccine because everybody has already gotten it. So I think that's part of the reason too. So, and that plays into, part of conspiracy theories. People are like, oh, where the flu go? They were right. No, it's because people are wearing masks and people are getting the flu shot that you're not really hearing about those
I think we're
hot
losing your
numbers.
audio. Okay, well, I'm sorry. I think we're losing your audio, but thank you so much for joining us. Please, everyone, be careful. COVID is real. We have frontline workers telling us. And, I know you had a friend who was supposed to join you, Yolanda Bryant. We look forward to having her back on the show when she can make it. So thank you again, Yolanda.
Yeah. Thank you so much for having me.
All right. We loved having
Thank
you.
you so much. Thank you for all of your hard work, Yolanda.
Wow. Powerful, right?
Yeah. Yeah.
But they still don't hear. They still don't listen.
That's the
Like,
problem.
it's-
I mean, that's the frustrating part. Nobody's really listening. I mean, again, like she said, it's just unless you're dealing with it directly. I mean, she said her cousin and another family member died from because actually I remember that she was supposed to be on the show a couple of months back, and she told me around that time that her cousin passed away, and she had to go deal with that. So that's tough. That's tough to deal with. I mean, sometimes unless you're in it, you don't believe it. So.
And like she was saying, people that, they don't believe it unless they see it with their own eyes. I've had people throw that, well, do you know anyone that's had COVID? Do you know anyone that's died? Like, well,
Yeah,
actually, I do,
Yeah.
but thanks for asking.
All right, guys.
Now what? Now what? Now that we've established that, so what do you got next? Like, come on, folks. We got to be better than this.
Let's get into our